Hi, I'm Anita Cook, and I'm currently both a medical student at Tulane School of Medicine, and I'm also a Master of Public Health student at the Celia Weatherhead Tulane School of Public Health and Tropical Medicine. I have about a year and a half to go before I complete both of my degrees. I was working at the Harry Thompson Center, and that site is amazing. It is a low barrier daytime center for the unhoused, and it offers about 4 service offerings. So the first service offering is hygiene. So people who are unhoused in the greater New Orleans area can come. They can take what's called a sunrise shower when they have no access to a shower. They can get a comb and brush their teeth, and do all the things that you and I don't even have to think about for daily hygiene. Their second service offering there is housing. So of course, one of the key concerns that our community has is, how am I going to be housed? And so we have case managers there who will interview them about their needs, who will help them get a homeless letter to prove that they've been homeless for 12 months, and really just work with them consistently until they can get housed. The health part was of particular interest to me because I do have a dual interest in patient care directly and also in public health more widely. And we do minor wound care there if people have scraped their leg living on the street, if they have become covered in body lice, that kind of thing. And so we have a health offering there, and I'd like to talk to you more about that in a minute. So I said health and housing and hygiene, and then hospitality. There's an amazing need. I always forget to say hospitality, but it's a core part of what we offered at Harry Thompson Center. There are people there who don't have anybody who's touched them all day, or to shake their hand, or just to smile at them. And we offer them a place to come. They get 2 meals, breakfast and lunch. So it's an amazing place to offer care and community. So if you were to walk into Harry Thompson Center before my APE started, there was an initiative to give unhoused people minor care. So first aid, wound care, feminine products, just advice about how to capture your blood pressure every day if you're a person who's going to go to get a hypertension appointment, that kind of thing. And so that care was very much given on the ground. So somebody might walk in, sit on a bench in Harry Thompson Center, they have a wound, and you might walk over to them right there on the bench. There wasn't a lot of privacy. When you were cleaning them, people might come up and interrupt you and say, hey, can you also help me find a drink? And you're in the middle of trying to give some minor wound care. So what's changed now, and right before I started, is that Harry Thompson Center has just recently won a grant to develop a full-blown clinic. And so you can imagine there will be rooms in which people can have individually given first aid, minor wound care, counseling, advice, that kind of thing. And so I heard about this during my interview for Harry Thompson Center, and I said, I would like to help you design a patient-centered care model for my major project here. And so they were completely on board with that. And what the goal of that was to really find out, how does this community want to be cared for, so that with this grant money, we can make sure we're delivering the kind of care to which they actually want to come. Right? Do they want to be called by their first name? Do they want to be called Mr. So-and-so or Miss Jones? What did they imagine? Did they imagine that they'll always have a companion coming with them to maybe help read instructions on the medicine, or they don't need any of that? And I thought, we need to interview people here. And I proposed and did implement focus groups and listening sessions to gather their needs with the idea of implementing these needs here. I think making a transition between gathering data and actually learning how to interpret that data and put it into a form that the center could pick up and use to implement it. I have to tell you, I was excited every day to be there. I'm a people person. I loved hearing people's stories. I loved capturing their needs. But when I went home from the center, I had a challenge before me, and that is, what is the center going to do with this data? How do you, as an internal public health consultant, take a narrative and turn it into a list, into a model, and that kind of thing? And that shaped the deliverables that I made for the center, And I think that is what's going to impact them going forward now that I'm gone. So normally in medical school and in the context that I have, I get to see one patient at a time, be it in the hospital or be it in family medicine where we're in a private practice office. I think the difference in public health is saying the community is my patient. And how do I treat this community? And so I think that this project was a good blend of both. I mean, there might be somebody that I have first aid for, but if you take a step back and say, now I have a person who's walked in and that person is covered with a visible rash. And that person is also sneezing and it looks like there are droplets coming into the air, and I'm concerned the person looks red. They look like they might have something that's contagious. Now I need to think beyond that individual and say, is the community at large at risk? And if they are, what do I need to do? And so I got to do that at Harry Thompson Center. I dealt with things like a very communicable disease, MRSA. You've probably heard about that. And so when you have somebody who has something that can be transmitted skin to skin or surface to skin like that, you instantly have to think, do I have processes in place that are fair and respectful to the entire community, or am I facing a question of singling a person out? If I don't have processes in place, I need them, right? And I need to communicate them to all in a respectful way. And so I got to do some brainstorming on the spot about could we get some signage? And within 24 hours, we were able to have signage about what was allowed with washing, or whether masks were allowed under certain circumstances if you have certain symptoms, or if you need to get a doctor's note and clearance to come back. Those things can all be barriers, right, to an unhoused community. Wait, I need a doctor's note? How do you think I'm going to get that? And we're able to really complete that circle and offer comprehensive care and say, no problem. We are going to help you make the appointment. You know, this is going to be covered for you either through your public insurance, or if you have no insurance, here's where you can go so that you can get that clearance. And in fact, we're going to walk beside you. I'm going to put my mask on with you now. You're not going to be alone in that. I'm going to wash my hands with you. And here are some steps. In fact, I'm going to help the doctor understand what it is I think you have so that they're prepared before you come in. And if you need a companion to go with you to the appointment, we can do that too. So I think that we were able to blend individual care, like I said, in that way, but also think about what was safe for the staff, what was safe for me, what was safe for all of the potential patients there, so that everybody didn't become an individual patient, right, as an outcome. I looked on Canvas and I am enrolled in a course called MD-MPH on Canvas. I have to put a thank you and a plug out to our advisor, Dr. Mark Dal Corso. He advises all of the dual degree students. And right there on Canvas on that MD-MPH course, there are 4 years listed, I believe, 2021, 22, 23, and 24. So I had the pleasure of consuming all of that data together on Canvas, and I searched by city. I searched by whether I wanted to work remotely, and ultimately I decided I wanted to do in-person in New Orleans because it just made sense. For somebody who wants to do clinical care and public health care, I felt like I needed to be in person, and I've been invested in this New Orleans community, and so I picked one there. And then I interviewed. Not everybody called back, just as a reach out first effort. And so of course my set in which I wanted to interview came from who called me back. And as soon as I walked into Harry Thompson Center, I knew that this was the real deal. This was not going to be an academic exercise. I have a personal value of making sure that whatever I do is not just for a grade or for a checklist. I wanted to know when I left that real people were going to be different in some way because of what I did. Work with everything you have with all your heart. Don't go with the idea that I need to have 2 final deliverables. I think I had about, 15 final deliverables. As I was working on my planning document on the questions I wanted to do for the focus group, I realized I need to put this in a survey, kind of like a Google survey document. And then I realized, gee, one of my questions is I want people to be able to look at sample intake forms and say, which one are you more comfortable with? So that meant I needed to develop intake forms. And then after I had done the focus group document, I realized I needed to put an interpretations presentation together, or what in the world was Harry Thompson Center going to do with all of my stuff? And then I needed a final report. If you work at something with your heart and not for the minimum, for the rubric, that's when you're gonna get meaningful difference. I think you can be a person who says, I wanna check this off, but my advice to you is pick a place where it won't be a burden or a chore to you. Pick a place that you're inspired every day, where people know your name and where they're saying, I can't believe you're doing this for free. Why are you doing this? That's when you're gonna be energized every day for your APE, when people stop and say, wait, what's in it for you? You know, pick a place you don't mind staying late. Pick a place where you can see the difference. And if you're not making enough difference, figure out how and keep working until you do. Yeah.
Thank you so much. That was great. I'm inspired.
Oh, good.